Welcome to the CanMed Coffee Talk podcast, where we talk with the leading minds in cannabis science, medicine, cultivation, and safety testing. I am your host, Ben Amirault, the marketing manager at Medicinal Genomics and proud member of the team that puts on the CanMed conference every year. Head over to canmedevents.com now to learn all about our CanMed 2021 event that will take place April 12th through 14th at the Pasadena Convention Center in Pasadena, California. And get your tickets today at our special early bird rate. While you're at canmedevents.com, be sure to sign up for email alerts to stay up to date with all the news surrounding this industry-leading event. The best place to sign up for those alerts is on our podcast page, which you can find in the main menu under the Media tab. You can also go there directly via canmedevents.com/coffeetalk. There's a sign-up form on that page, and if you complete it, you will be entered into a drawing to win 2 CanMed 2021 VIP dinner tickets. On this episode, I got to speak with Dr. Marion McNabb, who is the president of the Cannabis Center of Excellence and CEO of Cannabis Community Care and Research Network. Marion is a public health doctor by training and has nearly 20 years of global and domestic public health experience. Her team recently completed a veterans health and medical cannabis research study with the goal of gathering information from U.S. military veterans regarding their current health conditions, conventional medical treatments, medical cannabis use, and its effectiveness with self-reported health conditions and symptoms. We talked a lot about the veteran study, as well as other public health topics related to medical cannabis, including how military veterans use cannabis to treat a variety of conditions to reduce dependence on other medications, what barriers veterans face when trying to access medical cannabis, what programs have been established to assist veterans with the cost of cannabis medicine, how does veterans' use of medical cannabis compare to the general population, how has the COVID-19 pandemic changed cannabis use in terms of frequency, purchasing habits, and conditions? How implementing proper testing led to the eventual lift of the vape ban in Massachusetts, and how the vote to legalize adult use cannabis in New Jersey affects the issues of public health, social justice, and advocacy in that state. But before we get to that conversation, I do want to thank this episode's sponsor, Cannabis Science and Technology. Cannabis Science and Technology is proud to present a special supplement and free virtual Veterans Day e-symposium focused on medical cannabis treatment for veterans with PTSD. The supplement and symposium will feature Dr. Marion McNabb and the data she uncovered in her 2019 Veterans Health and Medical Cannabis study. In addition, the supplement will include articles with Dr. Stacy Gruber, veteran patient Stephen Mandiel, a VA caregiver, a nurse, and medical cannabis advocates, all heavily involved with this topic. The e-symposium will also feature a special panel discussion organized by Stephen Mandiel with the group of veterans from across the country. Go to CannabisScienceTech.com to learn more. And finally, it wouldn't be the CanMed Coffee Talk podcast without the Hemp and Coffee Exchange. If you don't know, hemp coffee is a healthy, delicious, natural product rich in trace minerals and nutrients, providing sustained energy without the crash of regular coffee. For more information, check out hempcoffeeexchange.com and use the promo code DRINKHEMP to get 10% off your purchase. Okay, as promised, here is my conversation with Dr. Marion McNabb. Good afternoon, Marion. Thanks for joining us.
Good afternoon, Ben. Thanks for having me.
Of course. And I'm really interested to talk with you today because many of our guests on the podcast we've had so far, and really a lot of the presenters that we have in CanMed in sort of the medical area, really speak from a clinician's perspective, sharing their experiences and their successes. But the work that you're planning to share at CanMed is really more focused on the patient's perspective, which I'll admit, unfortunately, isn't a perspective we hear nearly enough at CanMed. So that's why I'm really interested to talk with you about that. Um, so I guess instead of me telling you what you're presenting on, I want to give you the opportunity to kind of tell us and the audience about the data you've collected and what you'll be sharing at CanMed.
Yeah, thank you. And I'm really excited and honored to be presenting next year at CanMed. So, what the work that we did last year, I'm a public health doctor by training, so more of a population level researcher. So last year, I partnered with Stephen Mandile and Ann Brum of Joint Venture and Co. To launch the 2019 Veterans Health and Medical Cannabis Study. So this study was designed to understand from a veteran's perspective, using through an anonymous survey, how veterans, what are the current health conditions that they face, what are the current treatments that they are using to address their health conditions and symptoms, and then ask further about their medical cannabis use and how their medical cannabis use has impacted their life from a variety of perspectives. So we partnered also together with UMass Dartmouth. This study was approved by their IRB, and we had about an 8-month data collection period and captured data from 565 veterans nationally, but majority of the focus of our outreach and work was in Massachusetts, so around half of our sample size is from Massachusetts.
Excellent. And what data from this survey really stood out to you? Or perhaps what information is really sort of the take-home message that folks should know about it?
Yeah, so great question. Well, one of the most interesting things was to learn what health conditions veterans were using medical cannabis most commonly for. And those, out of the reported sample, 38% of veterans report using medical cannabis to address chronic pain as their top health condition, followed by 25% reporting medical cannabis is helpful for PTSD, and 9% reporting their top condition using medical cannabis for is anxiety. And so if we look at chronic pain, PTSD, and anxiety as some of the top conditions, we do, and I will present at CanMed some further data about each of those conditions and their medical cannabis consumption. But one of the most striking data points that we found in this study is the amount of veterans that are using medical cannabis to reduce unwanted over-the-counter medications or prescription medications related to their health conditions. So, in fact, out of our entire sample of 565, 78% report using medical cannabis to actively reduce the use of over-the-counter or prescription medications. So, from a public health perspective, when you step back and look at this, there's never been a documented death or lethal overdose with cannabis, but there has been documented, really unwanted side effects and the possibility of overdose with a lot of the medications that veterans are commonly prescribed, which I think I recently read a study that reviewed, over 10,000 veterans' records and found that often they're prescribed somewhere between 40 and 50 medications. So the understanding that medical cannabis is being reported by veterans as an alternative and actively trying to reduce the use of unwanted medications is pretty striking.
Wow. And now, are there sort of barriers to veterans getting access to this cannabis medicine?
Absolutely. So we ask, what are some of the major barriers for accessing? And actually 51% report money to purchase products that they want. 41% lack access to the actual right products for their conditions. 32% report they don't have the money required to get a medical card. Followed by stigma at 30%, owning a firearm at 29%, and then workplace testing at 24%. So we also asked, about how much money that veterans are spending, right? So if our top barriers are money to purchase products, access to the right products, which is market related, and then money to get a medical card. When we ask how much money are you spending per month on your over-the-counter or prescription medications, and then how much money are you spending per month on medical cannabis? And nationally, on average, veterans spend $98 a month on out-of-pocket expenses for prescription and over-the-counter meds, but they spend $343 a month on medical cannabis.
Wow.
So without having, understanding that it's being used as an alternative, medical cannabis is not covered by insurance. Yet, also the majority of our veterans in our sample are getting their prescriptions mailed directly to them from the VA. So, you could just really tease out, cost is a major barrier. However, so there's, examples of, I believe in Canada, they're starting to provide, free or low cost access to medical cannabis for veterans. And, in Massachusetts, Stephen Mandile, who I've worked with on this study and events last year, he partners with dispensaries to, share this information and to offer 40% off discount for 100% disabled veterans. So, the use of this information, I think, is really important. That's one of the areas of research that I'm most engaged with, is not only conducting studies and collecting data, but then how do you actually use that data for policy change or to implement programs or, provide access. So, and I think the other barrier that I think is quite interesting is the owning a firearm.
Right.
And because that's a federal regulation, I think, that's also something that, is unique to this population.
Yeah, that one sort of jumped out to me as well, because one would assume that veterans are probably more likely to own a firearm than maybe your average citizen. But so what is it about owning a firearm that makes access to cannabis difficult?
And Massachusetts, I'm not entirely sure about other states, but I'm not sure how enforced this is, but you cannot have a firearm if you are trying to get a medical card.
Mm.
Yeah. So one of the other really interesting findings from this study was actually, so we now see that veterans are using medical cannabis for a variety of their health conditions. They're wanting to use it as an alternative treatment. But one of the challenges specifically for veterans is that, they can access private care, but they also access care through the VA. And
Right.
because the VA is federally funded, VA clinicians are restricted from either becoming recommenders of medical cannabis, and basically don't have access to a lot of high quality education around where the state of the science is for medical cannabis. And the reason I think this is really important is because these veterans are working to, get access to an alternative treatment. And, it's important for them to discuss this with their healthcare providers. And so right now, policy at the VA is that, the clinicians and the veterans are allowed to, discuss about their medical cannabis use. They won't lose benefits, and that will be recorded in their medical record. But the clinician isn't allowed to advise on, types, dosages, and et cetera, or even really, engage with it. So we ask the veterans in our study, how many, is your VA doctor or clinical care provider aware about your medical cannabis use? And 60% said yes. And then we ask, is your VA doctor or healthcare provider supportive of your cannabis use? And 59% said they don't know, indicating there's not this clinical discussion happening, right? They've maybe informed the doctor, but, they're not discussing, they don't know if their clinician approves its use. So that's, I think, also another barrier to really finding what the right dose, what the right, products, dosages, et cetera, for veterans for medical cannabis.
Yeah, that's unfortunate. And unfortunately, in my other conversations with other healthcare providers, that's not an issue that's really exclusive to veterans. Unfortunately, there's a lot of there's a lot of citizens out there who feel they could benefit from medical cannabis, but there's just so few clinicians who are well educated and can really provide that guidance. So that is certainly a challenge. But it was encouraging to hear you say that, sort of in the absence of the VA giving benefits or giving access to medical cannabis, that some of the dispensaries were stepping up and providing discounted products to them. I think that's really encouraging. And I wonder, and this is probably something you've already looked into, but is there any chance that, private doctors or cannabis doctors specifically would be willing to sort of provide guidance to this population at a discounted rate or even perhaps for free?
Yeah, that's a very interesting question, and I think some providers out there are giving sometimes free discounts for a special, but for a short period of time, or definitely discounted discounts for medical cards. We actually used this study under the leadership of Steve last year. We used the data from the study to advocate for a bill in the Massachusetts State House to mimic a program similar to what's in Illinois, where the veteran has already been diagnosed with conditions by the VA, and to have that paperwork used as an evidence that would be required to get a medical card, so reducing the need to purchase. We did introduce that, use this data to support that. The bill did not go through this year, but changes will be made, and going to try in the next session. But I think it's a really, important aspect to have that medical cannabis specialist sort of guidance and help for veterans. I don't know anybody that is providing absolutely free ongoing services, but that would be great if they were.
Absolutely. And I guess another thing that sort of stood out was you saying that so many of these veterans are trying to use cannabis to sort of either replace or help reduce the amount of other medications that they're using, but the cost is sort of the barrier there. So it just seems so unfortunate that that has to be the case, because I think we all could agree that they would definitely benefit from reducing that.
Yeah. And actually, I led another study prior to this one in 2018 that looked at over 2,000. We had over 2,000 respondents. It was an open cannabis consumer and patient study, so general population. And we found very similar findings. Over 70% of people in that study, of over 2,000 sample, were also using cannabis to reduce prescription over-the-counter medications. And I think this is just an extremely important public health, reality that we have to look at. If you have a legal, safe, alternative treatment that's available, I think it's a public health right to make sure that that's accessible. But the other interesting parts in the veteran study and in the consumer study that we ran is that they also report reducing the use of alcohol and tobacco, much less now, with the use of cannabis. So if you think about this, it's like almost a harm reduction method for a variety of substances that, are more lethal. It's not only medications, it's medications, tobacco, alcohol, in addition to both physical and psychological relief. So.
Yeah, and I'm glad you brought up that survey, because I was looking at that data as well, and really one of the things that jumped out to me, and it seemed to be almost the same percentage on the veterans study too, was that 80% of the respondents said that using cannabis just generally helps their quality of life, which and that was sort of the top response for sort of how cannabis impacts their daily lives, and it seems to ring true with what you just said. If you're using cannabis and you're just generally feeling better, that you're probably less likely to be resorting to some of those destructive behaviors.
Yep. Yeah, or finding it's a better alternative.
Definitely. And so I wondered, were there any other kind of interesting correlations, or maybe even some interesting differences, sort of comparing the data from the veteran survey to the sort of more open study?
Yeah, so the consumer and patient study and the veteran study, I think one of the differences is in the top conditions. So in the veteran study, more veterans express, report having PTSD. Um, and so I think, that's one major difference. We see similarities in, like we just talked about, in the medication reduction. Um, and there's, I think, differences a little bit in smoke and preferred methods and preferred time of day.
Mm,
Interestingly, we have, I think these populations also, in the veterans study, we had about half or over half of the respondents were over the age of 65. Um, if I've got that right, let me just check on myself. That's a pretty, like a substantially older population versus what we had in our other studies. So, but you give me the idea. I want to dig in further and really try and tease out those differences. Maybe I'll write a blog and I'll make sure to send it to everybody who's listening.
yeah, that'd be great, and be happy to share it with the audience. And if you do publish it before uh, this episode goes live, I'd be happy to put it in the show notes so people have a quick way to get to it.
Awesome.
Um, One of the things that stood out to me, and you sort of touched on it there, was that I think this was at least in the more open study, that 54% of respondents said that smoking flower was their primary method of consuming cannabis. And then there was another question that sort of asked for their preferred method, where they could select multiple different ones, and still smoking flower was the top choice at 79%. And maybe it's just because I'm more in the industry and aware of all the different types of cannabis products that are out there, whether it be vapes or edibles or tinctures or patches, that it's interesting to see that smoking flower is still such a dominant preferred method. And I was wondering if you had any thoughts on that. Is that sort of just because it's sort of the easiest one to access, or the most widely known one? I didn't know if you had any thoughts on that.
Yeah, it's a really good question. So in both of these studies, we focused heavily on the Massachusetts market, although they were national. It was a convenient sampling approach, and anybody nationally could take the study. But we did targeted outreach in Massachusetts, and I think it might be because of the nature of the industry at that time, and the availability of products. And not having as many now, that we do have now or could have in the future, or even the diversity of products in other markets outside of Massachusetts, I think is much greater than what's available here. So maybe it's a factor of that product availability, because we see that access to the right products was one of the barriers for the veterans study.
Mm.
So maybe they want vapes and edibles, and it's too far away, or only one dispensary offers it, or that kind of stuff. I also think it's probably also it's just a very common, people are traditionally very used to smoking flower, and if people are new into cannabis now, I think it can be intimidating to do some of the other methods of administration. Maybe they're unfamiliar, maybe it needs to be more patient education around that, so people gravitate towards simple flower. I know that when I walked into the dispensary the first time, I'm a consumer, I'm a patient, but I was intimidated to ask questions and this and that.
Hmm.
So I think it's probably access, availability in the market, awareness about how to consume those other methods, comfortability in consuming those other types, etc.
Yeah, and maybe one thing that sort of struck me as you were answering there is, could there perhaps be a correlation between the method of administration and sort of the symptoms that they're looking to alleviate?
Exactly. I think that's a great point. Like whether or not you're using a tincture or an RSO or a flower. I mean, all of those by condition, I think people definitely probably, if they're, very committed to learning how to dial in their dosage and everything that they need, What's interesting too is we've run these two studies, the open consumer and then the veterans health. And earlier this year, together with UMass Dartmouth, launched the COVID-19 medical cannabis and consumer study that I'm running right now. And so we launched that study, and we have several partners in Massachusetts, and um, really looking at the impact of COVID-19 on patients and consumers. So again, what are they consuming for what health condition or symptom, how much, and how has this changed during COVID? And I'm just trying to pull up the data now, but speaking of, cannabis consumption methods, let's see, let me find it here. We did ask, because of COVID, have you, switched? Has your cannabis use changed, basically? Interestingly, that 14% said that they switched their preferred method for consuming cannabis, which I think is really, really interesting. And 47% stated that they consume cannabis more now since COVID-19 started. And only 11% say they consume cannabis less now. So, yeah, people are consuming more cannabis. They're also reporting, using cannabis for top health conditions differently than the other studies. I think now we're living in an environment of COVID, which is heightened anxiety, also just heightened risk for people who have underlying health conditions like medical cannabis patients. So I think, medical cannabis patients I think should be considered a vulnerable population right now within the epidemic or the pandemic. So and they're also still reporting in our COVID-19 study replacing the use of alcohol or prescription medications with the use of cannabis.
Wow, so that's interesting. What other questions are you asking as part of this survey?
So we asked, how has COVID-19 impacted your purchasing habits? And about 40% report that it has. One couldn't access legal recreational cannabis. Now 14% reported now since COVID, they purchase cannabis in the illicit market or unregulated market. 12% now only order for curbside pickup. 10% reported they registered to get a medical cannabis card. And that's, quite interesting. The other questions that we ask are, the top health conditions, et cetera, but what are the barriers, again, to purchasing, to accessing cannabis, both pre and post-COVID. And access to the right products is the top barrier, and that's increased since COVID started. And then money to obtain cannabis products has also increased since COVID started. Very interesting. Stigma has decreased as a barrier. Place to consume cannabis has decreased as a barrier. Money required to get a medical card decreased as a barrier. And so did lack of healthcare provider involvement. Really interesting.
Yeah, and so what is that compared to? Is that compared to the study that you did in 2018, or?
We asked in the survey, pre-COVID, what were your barriers, and post-COVID, what are your barriers?
Interesting.
Yeah, and to rate their top barriers. Very interesting. We also ask about COVID infection. 8% of the respondents reported they were infected with COVID and received the results. 11% respondents think they have COVID, but they can't access a test. And 13% report they have current symptoms of COVID. So all of this is very interesting because of the emerging evidence around cannabis, CBD, terpenes, cannabinoid profiles that are coming out right now from a variety of research institutions related to the impact of cannabis on COVID, right? By interrupting the cytokine storm at the end stage, or, different researchers are looking at either THC or CBD or a combination of different, again, cannabinoids and terpenes and how they may actually be a possible prevention measure. So it's quite interesting data that's coming out of, Israel and Canada and South Carolina and Georgia and other universities, University of Miami. So as part of this study, I'm organizing an event to be held in December around COVID and cannabis, and where's the research and standing at that point, and then also from a clinical perspective, to really lead an engaging virtual event I've invited several of these researchers to present some of their preliminary findings, some clinicians, and then we'll have a nice discussion at the end about the state of the evidence around this and kind of what's the latest.
That sounds excellent. And I don't want to invite ourselves, but I know that some of the folks on our team here have been looking into COVID and cannabis, more on the testing side to make sure that we have sort of a testing assay to measure if there's any COVID on cannabis products to sort of protect consumer safety. I will say we've seen no evidence of that in the marketplace, that's out there. And the main reason that our CSO Kevin McKernan felt it important to create this test was more so because one of the encouraging signs of the pandemic was that in many states they deemed cannabis to be essential, which I think we can all agree was the right move to make. But one of the concerns that we had here was that if, for whatever reason, there ever was COVID found on cannabis, that would completely shut down the supply chain, and so many of these patients wouldn't have access to their medicine. So in order to prevent that, we wanted to make sure that there was a test available that should that become an issue, that the testing labs could run to make sure that medical cannabis is still functioning. So thankfully there really hasn't been a need for that, but it's something that we felt very strongly about. And like I said, I know that if you gave him the chance, that Kevin would be more than happy to take part in your event.
Yeah,
If you'd have.
I would love it. I think that's really interesting. And I, thank you all for that, because that would have been a disaster to say, could have really shut down, and put, patients at risk. So thank you guys for leading that work. And definitely, I would love Kevin to be part of this event.
Yeah. And speaking of sort of maybe there being a ban that took medicine away from patients, I know that when I was doing my research on the many things that you're involved in, that you were involved in sort of advocating here in Massachusetts to lift the vape ban that had been implemented after there was the Vape Scare, where a lot of people were getting sick there. So I was wondering if you'd like to speak a bit about that, since it seems like a nice segue.
Yeah. So last year there was sweeping cases of a valley going across the United States. So the sort of issues around potentially contaminated products, or really just a lack of understanding about what was causing E Valley. And Governor Baker took very swift action to ban vapes in Massachusetts. I had looked at this issue in terms of, I just scientifically started to look from an epidemiological perspective. Where were the cases? Where they be reporting? Is this coming from tobacco vapes, or is this coming from THC vapes? And just try to start to dig into whatever I could find online. And really, at that time, also very quickly, MCR Labs put together the vitamin E acetate test to start testing products. So we actually worked together on the, trying to figure out the science of this from the different perspectives. So they put together that. I started to look into, like I said, what be my potential causes. I actually reached out to my father as well. He's an international infectious disease epidemiologist. And I thought it was a little premature to have such swift action without a little bit more further testing, which only took a little bit of time to do, but it really hurt the industry and really hurt medical patients that rely on vapes. Yeah, we put together a press conference around this, invited Dr. Peter Grinspoon, Commissioner Shelley Title, different experts to give their opinions on the vape ban. And so that we've got that recording. And then, yeah, did advocacy around that. They eventually lifted it. And then, now since we understand that Massachusetts, I think it was a premature intervention. Some studies that have come out later have documented that it had really no impact on Valley cases. I think yeah, that was an interesting time and an interesting time for the industry, and I think it took a really big hit for patient access and just for the industry at large.
Yeah, and again, just another example of how sort of the knee-jerk reaction can be just to ban, and how that unfortunately is sort of a blunt instrument that's not always the best one to use. And as you demonstrated, having good testing techniques to ensure patient safety is really the way to go, rather than just kind of do a wholesale ban. So
Absolutely.
thank you for your work on that.
Yeah, absolutely. We ran a quick survey of that as well because me and studies, um, and we did find that people when they don't have access to things, they're and you can't just cut them off with a ban. You know what I mean? So people they'll start searching products on the unregulated market that are not tested and that are not necessarily fully safe. Driving across borders to get things. Saw that also probably when adult use was deemed non-essential in Massachusetts with COVID.
Right.
So in our study, people like we said, I said that some people have now since COVID had to seek their products on the unregulated market. I'm going to look at that over time, since I'm going to look at the timestamp of when adult use was banned in Massachusetts and that data versus now when it's back open, and see if those numbers change. But
Yeah, that'll be interesting to see.
yeah, yeah,
So I know we're getting towards the end here, and I did want to give you an opportunity that I know, in addition to the work that you're doing in terms of doing surveys and sort of larger scale studies, that you also do a lot of work in terms of advocacy and social justice. So I wanted to kind of get an update and see if there's any new things that you're working on that you'd like to share with the audience.
awesome. Yeah, thank you. Yeah, long running advocate for social justice and addressing the failed drug war through effective programming, education, access, etc. Last year, we were a state approved social equity training vendor for the Massachusetts Cannabis Control Commission. So, taught 9 courses in Massachusetts. And this year, quite excited to partner with Rider University and my colleague, Dr. Sarah Trocchio, who's a professor in criminal justice at Rider. She's leading a course, and I'm one of 3 mentors in the course that's focused on New Jersey and focused on New Jersey legalization and the vote that's coming up and social equity in New Jersey. So we are, the students are grouped into 3 consulting groups, one focused on public health, one focused on social justice, and one focused on advocacy. And the students are actually running their own research study that's approved with the Rider IRB as part of their learning methods. And so it's open right now. So if you know anybody in New Jersey, please take the survey. It'll help the students. Basically asking opinions about legalization and social justice in the state. And the students will be analyzing this data and producing a report that would provide recommendations for future commissions or advocates or others in the state around those topics of legalization and social justice. So we are trying to make this a very actionable study. It's very quick data collection. So before November 3rd, if anybody is a New Jersey resident, we encourage you to take the survey, and we'll be having a virtual event on December 2 at 3 p.m. where the students will present the findings, and we'll have various advocates and experts from New Jersey also participating in the virtual event.
Wow, that's great. And if you send over the links, I'd be happy to put that in the show notes so people can quickly get to that. if they're able to take the survey, or definitely sign up for that event. And I think that's very appropriate you looking into New Jersey, because I know that a lot of folks in the industry here, especially us on the East Coast, are very interested to see what happens in New Jersey. It would be only the second state in the Northeast to really go full adult use. And I think the general consensus is if New Jersey goes legal, pretty much everyone else is going to follow. So that is definitely going to be a big vote that we're all paying attention to in November, in addition to another pretty big one that's going to be happening in November. So I guess just finishing up here, I did want to give you a chance to let everyone know about the different organizations that you're involved in, and plug those websites, social media, anything like that. Now's your opportunity.
Awesome. Yeah, and thank you all for listening. So I'm the president of Cannabis Center of Excellence. It's a 501c3 nonprofit aimed at improving access to research, education, and social justice in the cannabis industry. You can find us at www.cannacenterofexcellence.org. And we're on Facebook, Twitter, Instagram, and LinkedIn. So you can find me at Marion at cannacenterofexcellence.org. Always open to collaborations, ideas, innovations, trying to bring the best foot forward in the cannabis industry. So thank you, Ben, for the time and for having me on the podcast today.
Thank you, Marion. We look forward to seeing you out in Pasadena, and I think that'll be a great opportunity for you to connect with those innovators and collaborators. So we're looking forward to it.
Me as well.
I hope you enjoyed my conversation with Dr. McNabb. Marion was kind enough to send along all the links we mentioned in the interview, which I've added to the show description on our blog, so please do check those out. And thanks again to Cannabis Science and Technology for sponsoring this week's episode. I hope you will sign up for their Veterans Day e-symposium to learn more about how cannabis is being used to care for our military veterans. Again, you can go to cannabissciencetech.com to learn more about that event. Coincidentally enough, our next episode of the CanMed Coffee Talk podcast will drop on Veterans Day, November 11th. In the meantime, please go to canmedevents.com/coffeetalk and sign up for email updates. That will enter you into that drawing to win 2 tickets to our CanMed 2021 VIP dinner and keep you up to date on all things CanMed 2021. Give us a follow on social media too. We are on Facebook, Instagram, Twitter, and LinkedIn. Just search for CanMed Events. And lastly, if you're listening via a podcast app, you can subscribe to our feed so that new episodes automatically download to your device. And if you do like what you hear, please leave us a 5-star review. All right, that's it from us. Stay safe, stay healthy, and be sure to come back for the next episode of CanMed Coffee Talk.